Hello, this is Dr. Tyler Hamel, Kingwood chiropractor and nutritionist, talking today about carpal tunnel syndrome. A lot of you guys out there that are using computers all the time in this kind of position puts a lot of stress on the forearms, the front and the back. Me as a chiropractor, same kind of thing. When I'm working on patients, I put a lot of stress here. I exercise, I play tennis, same kind of thing. So my forearms here are always very tight, but I do not have carpal tunnel syndrome and I don't want to get it. So what can you guys do at home to help with these tight muscles here? There's a couple different things. If you've never done it before, you can just take your fingers and kind of dig into the muscles here and you'll feel it when you're on the right spot. And with my hand, I can move it back and forth, up and down, side to side, rotate it. And you're trying to release these muscles that are on the side of the arm. The same thing on the front side here, you can do the same thing. Dig your thumb into those muscles, move it around. You'll feel the same kind of thing. And if you guys have never done that before, it's going to be pretty darn uncomfortable, but at least you're doing it to yourself, so it's not too bad in that respect. So if you want to go to the next level, then you can use something like a baseball. So what I do is I'll put this baseball on the table here, rest my arm on the baseball, and I'm going to dig and lean into the baseball. Again, until I feel that same kind of tension or same uncomfortable feeling. So I have a spot right there that's really uncomfortable, but I can control the amount of pressure that I'm putting in there because I'm leaning into the baseball with my own weight. Same thing on the other side. Up in the muscle here in the elbow, I'm going to lean into this here and go back and forth, back and forth. You're never going to go on the elbow joint itself. It's just going to be the muscles that are around it. So you can do the inside in here and also you can do the outside. So if you want to do something for carpal tunnel, you might already have it. And if you don't want to get surgery, which I never recommend getting surgery unless you absolutely have to, then you can use something like this, manual type of therapy on your own. Signs of carpal tunnel, you could have lots of pain in here. You could have tingly, lack of circulation into the hand. That's probably the most common, but a lot of people don't realize that it's coming from in these areas. These tendons that go into the elbow in the front and the back, they can only do so much before they get really, really, really tight, and they put lots of stress on the elbow, lots of stress on the vasculature and the nerves that run into the hand, and that's why you guys might have tingly or numbness into the hand. I'm Dr. Tyler Hamel. Hope you learned something today about carpal tunnel and what you can do at home. All you need is a baseball. You could use a softball, you could use a lacrosse ball, and if you've never done it before, just start out with your fingers. Push in here, move around, move down, move down. Just cover the whole length of the forearm. If you learned something about carpal tunnel in this video, please like it, share it. There are a lot of people out there that they have signs of carpal tunnel and maybe they're thinking about getting carpal tunnel surgery, but if they can go through this type of therapy, they'll be a lot better and they don't have to get surgery, which is kind of what everybody wants. So share this with them. I'm sure they would appreciate it. If you have any questions about carpal tunnel, put it in the chat box below. I'd love to help you. I'd love to answer any questions I can. And stay tuned for the next video. We'll see you soon.